sa mga kababaihan na yun nga, sabi namin ni MJ kanina, gustong magkaroon ng baby o di kaya may baby na pero gustong i-freeze muna yung eggs for many years to come, whatever, until they're ready to get pregnant again, no? May option po para sa inyo, egg freezing ang tawag dyan.
Oo. So ngayon tatalakayin natin the nitty-gritty. Paano nga ba yung proseso nito? At magkano naman kaya ang aabutin? Anong magkano ang ating isi-save para rito? Ang tanong natin, sasagutin ni Dr. Ednalyn Ong How, Medical Director of Conceive IVP Manila.
Good morning, Doc!
Good morning, Doc!
Good morning, Inay MJ and Mamo Tintin.
Oh my gosh!
Po sa ating mga manunood. Magandang umaga po sa inyong lahat.
Grabe.
Na-excite naman ako kasi
Sobra.
ikaw pala mismo ang celebrated doctor na although sa post ni Carla, hindi ko alam kung na-mention niya kayo
Yes.
specifically.
Yes.
Ayan, kaya ikaw pala si Doc Ednalyn na yun, na nag-harvest ng eggs kay Carla Abellana.
Opo.
Oo. At ngayon po, ano napapansin nyo bago tayo na sa proseso, no? Gaano ka in demand ang egg freezing ngayon?
So, right now, it's becoming more popular. Mas madami na kaming nakukuhang patients who are coming in just for egg freezing or what we call the social egg freezing. Kasi meron kasing medical egg freezing na
Ano
tinatawag.
yung difference?
So, before, yung egg freezing, nung inintroduce siya or una siyang ginagawa, it's really for medical reasons. So, ito yung kunwari, yung babae na diagnosed with cancer. So, before they undergo surgery or chemotherapy, so nire-refer sila sa amin for egg freezing. Lalo na kung yung surgery na gagawin sa kanila or yung chemotherapy is makaka-affect sa ovarian reserve nila. Yung pool of eggs na meron tayo. Kasi once naubos yon, hindi yun ma-replenish. Mauubos lang siya. Kasi nung pinanganak tayo, nandun na lahat yon. Lahat yon ng eggs natin na ipanganak na with us, unti-unti siyang nawawala.
Parang collagen. Siyempre beauty agad, yung parang collagen.
Na unti-unting nawawala.
Nawawala.
Ganun pala.
Oo.
Hindi pala, akala ko kasi, Doc, as you grow older, year by year, nagpo-produce pa ng
No.
eggs. Hindi
Or
pala.
nare-revive.
No.
Hindi pala, nandun na pala
Nandun na
lahat.
siya.
Oo.
So, hindi na siya nadadagdagan. Unlike men who keep on producing every 3 months, tayo, kung ano yung na-produce nung pinanganak tayo, yun na yun. So, we were born with all the eggs that we will ever have.
How many eggs does a woman have? Curious lang.
Actually, at birth, that's around 2 million. And then tapos paunti na siya ng paunti. By puberty, around 500,000 na. At around 37
30s?
years old,
Yeah.
around ano na lang siya, 25,000.
Pag 40s?
Siguro yung mga 51, around 1,000 na lang siya. So, konti-konti lang. And then, yung whole reproductive lifespan natin, we only use around 250 eggs lang talaga.
Ayun. Wow.
Grabe. Ngayon,
Yes.
FYI.
How old are you na?
36.
So, she has...
So, around 25,000.
marami ka pang eggs mo na pa-harvest mo na.
Oo nga eh.
Hindi. Well, kaya pa. Mag-baby ka na talaga
Oo.
mo. No? Wala ka pang 40s eh.
Pero bukod po dito, yung sinasabi niyo doon, yun yung medical.
Oh, yeah.
Ngayon,
So,
ginagawa
sorry.
na
Ay,
lang siya.
another one. Medical
So, that's
and...
the medical. Yun yung naging reason before. Not only for cancer, kunwari,
Yeah.
they will have to undergo surgery na
Related to ano?
to the ovaries na talagang pag na-surgery, matatanggal yung ovary nila or kunwari, talagang yung cystectomy pero ang sobrang laki, konti na lang yung maiiwan na ovary. So sometimes we can do egg freezing first. Yun yung dating indication niya for fertility preservation for medical reasons. Now, it has been being used to circumvent age-related infertility. So, kaya tinatawag siyang social egg freezing kasi it's not medically indicated. So, ito, para to sa mga babae, kababaihan, na hindi pa ready to get pregnant for whatever reason. Kunwari, nag-aaral pa sila or they want to be more, mag-improve sa career pa nila. Or even as simple as hindi pa nila nahanap yung perfect partner father.
Yeah, and
Yes.
And because ang iba na yung goals ngayon ng kababaihan, drastically change. Kaya nga may mga bansa tayo like Korea, Japan, who gives incentives, kahit Australia, who gives incentives if i-prioritize yung pamilya at yung baby making, di ba? Dahil ang dami na talagang, lalo na yung mga developed countries na ang daming pwedeng gawin, daming pwedeng puntahan, di ba? Ba't pa siya mag-baby? In this economy? Charot. Di ba yung lagi sinasabi ng mga Gen Z ngayon, in this economy? Mag-baby pa ba ako in this economy? Ang mahal-mahal.
Last priority na yan ng mga kabataan ngayon, globally ha,
Oo.
na mag-baby. Kaya nga, di ba, tama kayo, nanghihikayat ngayon, pati Italy, tumira lang kayo dito, kami na magbabay magbabayad sa inyo kasi sobrang matatanda nang nandun. Pag namatay pa at nawala yung matatanda na yun, what will happen to their country?
Oo.
Di ba? Pero ilang
That's what's
taon?
happening to Japan.
Japan,
Old
Korea.
population, yes.
Oh, marami. Old population na
Oo.
talaga.
And on the flip side of it, kaya rin maganda itong egg freezing na option is because honestly, if you're listening to us right now and you have the budget at successful ka na kahit young in your
Tama
20s
naman.
ka pa lang,
Yeah.
wala ka pang partner, you can have this option kasi mas healthy pa yung eggs
Yes.
mo at
Correct.
marami pang
Yeah,
pwedeng
at the time of
ma-harvest.
harvest.
Yung
Yeah.
quality ng itlog mo ngayon,
pa.
maganda.
Yeah, pero gaano katagal pwede i-freeze yung egg?
So, that's correct. The earlier na magawa siya, the better because you are right. Ano siya? The sooner kasi mas bata ka, mas maganda pa yung quality.
Premium eggs.
Kasi actually, yung mga studies ngayon, nakikita nila at the age of 35, drastic yung pagbaba ng number of eggs. And not only the quantity, even the quality. Kaya nga at the age of 35, biglang bagsak ang fertility rate mo and yung miscarriage mo tumataas naman. It's because yung mga abnormal eggs madami na din. So kaya gusto natin mas maaga, mas maganda kasi quality eggs pa siya.
Question is, how much?
So how much? Hindi naman masyadong mahal. So in our clinics, Cato clinics, usually we ask patient to prepare around 220 to 250,000.
Ooh.
That's for the process. Meaning giving you the medications, getting the egg, and that will include 3 years of freezing already.
Oh, wow.
I'm speaking for our centers, okay?
Yes,
And
yes,
then
yes.
after the 3rd year, you will have to pay 13,500 more or less
Per
for
year.
the yearly freezing.
Wow!
For
not
all the
bad.
eggs.
Hindi naman pala milyon.
No?
Alam mo
Oo,
ba,
oo.
ito ako nagbibiro.
Kasi-
Dati may show sa TV5, Titas of Manila.
Oo.
Hindi pa ako inay nun. Mga back in 2017 ata yun. Tapos nun, yung topic ko nun, kakabukas lang nung egg freezing sa isang hospital. And parang starting at 60K dati. So, pero pero pag narinig mo ngayon yung pinapaprepare, sobrang laki. Ang sinasabi ni Doc Edna din, sobrang okay yung
Diba?
price nila.
250.
Sobrang okay yung price nila. And yung yearly na 13,000, 'di ba? Malay mo gusto mo nang gamitin yung mga
Yeah,
eggs
yeah.
mo, 'di ba?
Yes.
But let's talk about the process. What is the process? You said may medication. You start
Yes.
with
Okay. So, paghahanda muna. So, para maging systematic tayo. So, when the patient comes to us wanting to do egg freezing, so we get the history, we run some tests. And when everything is okay, we start them with some vitamins, with some supplements, and then we tell them to stop smoking first, stop drinking, and if they need to lose weight, we advise them that. And then, after that, pag ready na, they come to the clinic, we advise them to come to the clinic around day 2 to day 3 of their cycle. So, day 1 is the first day of the cycle. So, we think this is still the best time to do the stimulation. So, on day 2, we will see them in the center or in the clinic. We'll do ultrasound, and then if everything is okay, we'll start giving them medications. So, that's around 8 to 11 days of injections. And then, during the time that we're giving injections, we usually monitor it through ultrasound. So, when the follicles are big enough, then we schedule the patient. We trigger them for the egg harvest. So, yung egg harvest, sa clinic lang siya ginagawa. So, hindi kailangan ma-admit sa hospital. Outpatient, the process is only 15 to 30 minutes depending
wow.
on the number of eggs na
Makikita na agad before the
Makukuha.
harvest itself, yung number of eggs na ma-harvest.
number of follicles yung
Follicles,
makikita.
follicles,
Kasi yun yung sisip-sipin mo eh. Yun yung i-aspirate mo. So, the egg is inside
the
the follicle.
Yeah.
sa vagina.
So,
Yung
the
which one?
vagina. Yung
Through the
harvesting.
vagina. So,
Oo,
yun.
vaginal.
So,
ganyan
yung
tawag.
process is parang, di ba pag nakapag-transvaginal ultrasound na
yes,
kayo,
ganun.
it's the same. Ang difference lang, yung probe ng transvaginal, may needle guide where we will insert the needle. So, this needle will pass through the cul-de-sac papunta sa ovary. So,
Oh.
hindi siya ganun ka-invasive. So,
Tsaka hindi siya ganun kasakit na sinasabi. Sabi na masakit. May discomfort lang.
meron. But then, like what I said, pwede naman kasing matulog. Kailangan, pwede naman sedated. Although, some of our patients, they want to watch the process, so they're
Oo,
awake.
di ba?
Yes.
Hinarvest nyo ba talaga?
And then
Mga turista.
they just want, we just do it under local anesthesia.
Si Miss
So,
Carla ba was asleep?
Can I answer
Or
that?
matapang siya?
No, maybe,
Okay lang.
I don't think,
Baka patient.
Yes.
Ay, oo. Kung ako yun, tulog na lang.
Oh, correct.
Sleep na lang ako.
Oo, actually.
Gising ko, sabi mo lang sa
I
akin, Doc,
trust
ilang
you.
eggs.
I trust you.
Mananaginip na lang ako.
What vitamins are those?
Yeah, we just give some supplements prior, such as
Folic
folic acid
acid.
or other forms, and then some antioxidants. We do give that to make the environment better. Parang less trauma na to the
And then, pag ready na, o let's say ready na, na-harvest na, gusto ko na magbuntis.
Okay.
Ibabalik ba yun sa loob?
So pag nakuha na namin yung eggs, going back doon, di ba, nandun pa lang tayo, na-aspirate na namin.
Okay.
On the same day, malalaman namin yon kung may laman yung follicles mo or wala. So pag nakita na ng embryologist and then they see na mature, if you freeze nila yon on the same day.
Okay.
So we will advise you, ito yung number of eggs na na-freeze namin. So we can freeze it indefinitely. That's your question earlier at Mamu that I failed to answer. So wala po siyang expiration. Although, kung makakabasa kayo ng mga regulations sa Europe, may mga nagsasabi sila 5 years, 10 years, but these are country-specific regulations. Kasi siguro parang hindi ma-imbak ng hindi na nagagamit.
But scientifically,
so that's their rule na parang after 5 years, 10 years, itatapon na nila pag hindi mo siya binalikan. But technically, hindi talaga siya nag-expire. You can freeze it indefinitely.
Kung alam ko lang, Dok, sana yung
Sana
in my 20s, nag-harvest na ako marami, para kahit 60 na ako.
Pwede pa.
Seriously, even if you're late 50s, 60s, can you actually carry a baby pa in your womb? Parang di
Di ba we have heard of such news? Kasi
40s na yung
technically, meron pa din. Pwede ba din? But kasi hindi na physiologic. Diba? Kasi nga, even our hormones, wala na. More difficult. But we've seen the news. Meron.
Possible.
Pwede. Kasi you can replace the hormones eh.
If you really want.
Pero kasi even your body, hindi na siya physiologically parang for carrying a baby. Your uterus, di ba, matanda na din yun. So it's not just the eggs. All of our organ systems are also
So
going
after
out.
freezing, let's say gusto mo na nga
Gamitin.
Gamitin.
Sorry. So after nyan, it's not like we are gonna put it back sa'yo and then you can get pregnant on your own. That's not how it is. Doon na tayo sa IVF.
Yun na, doon pupunta
So
sa IVF.
yes, your husband has to come to the clinic. He will provide the sperm. And then, on that day, i-sow namin yung eggs. Tapos, i-inseminate namin with the sperm of your husband. I-culture namin siya to embryos. So, aalagaan muna namin siya after 3 days, after 5 days, usually 5 days. Tapos, pag ready na, that's the time we put it back sa uterus mo. So, may timing din yon. Hindi siya yung any day, gusto ko nang ilagay mo yung embryo ko sa uterus ko. Usually, no. It's usually based on your ovulation then. Kasi may window of implantation tayo eh. Yun yung tatimingan namin.
And kumakagat ba agad? Kasi just to manage the expectations. Dahil I know even IVF is very difficult, diba? Parang
That's right.
1 in 3 lang yung nagpo-prosper sa ratio daw na
At mahal,
narinig
yun ang mahal,
natin.
yung
Okay.
IVF.
Oo, diba? So ibang gastos pa yon.
Ibang gastos pa yon. So yung kaninang sinabi ko, hanggang freezing lang ng eggs yun.
Yung 150.
So kung mag-proceed ka sa IVF, ibang gastos na din.
How much naman yon?
So yung, kasi kami, in our centers, yung Kato clinics namin, we advise patients to prepare around 400 to 450 for the whole process ng IVF
Okay.
Pero
Ay, million, Dok.
hindi naman.
Kasi ilang cycles na IVF
that's just
yun?
one cycle. One cycle of
cycle.
getting the egg and one cycle of putting it back. So one transfer, one OPU, then that's around 400
Kasi I know
to
someone went to
450.
Singapore, million ginastos eh.
Mahal kasi sa Singapore eh,
Million,
diba?
pero
Everything.
hindi naging successful.
And then I want to answer your question to manage the expectations. Kasi even the eggs, when you throw them, hindi lahat yan magsasurvive. Meron tayong sinasabing survival rate after throwing. So for eggs, even international rates, that's only about 60 to 80%. So hindi 100% yan na tinuo mo. Kunwari, 10 eggs. Pag tinuo mo, 10 din yan na magsasurvive. So that's one. Another, with IVF, when we combine it already, and then nakabuo na tayo ng embryo, and we put it back, chances of getting pregnant depending on the age. Ano pa yan? Very good, parang important factor yung age. Younger patients, probably less than 40, kaya pa yan ng 50% na pregnancy rate once we put it back per embryo transfer. But for older patients, baka nag-range na yan ng mga 30 to 40% per embryo transfer.
Thanks for that. What if gusto ko magkaroon ng... Ako talaga yung term ko. Kasi gustong sa surrogate mother, i-implant yung embryo. Ayan.
So, unfortunately, sa Pilipinas,
Hindi legal.
hindi siya legal. We don't have laws to regulate it, kaya hindi natin siya ginagawa.
Paano kung dadalhin yung embryo sa ibang bansa kung saan legal? Pwede ba yun, Dok? Dadalhin sa Russia. Di ba si Joel Cruz dun sa ano?
So, they want, pwede din naman kasi
Import.
na they just want to, yung eggs nila. Actually, when the patients come to us, isa yan sa mga dinidiscuss namin. That we don't do third-party IVF, so no donor sperm, donor egg, and surrogacy. So it's not just surrogacy, para alam nila.
Ayun.
And then, so, if they want to use it, then they'll have to transfer it to other clinics. Pwede naman kasing i-move yung eggs, even abroad. Kaya.
Ito naman generic question, Doc. Kasi dito we have our rules. Kailangan partner mo, etc. But abroad, you can, right?
Yeah.
What if the patient did it while she was abroad, na nagpa-egg freezing siya, etc. Pwedeng mag-surrogacy doon.
Yeah.
Long after the mom is gone, pwede bang i-avail ng
Ay,
husband?
tama. Uy, good
Diba?
question yan.
Kasi diba,
Halimbawa,
pagka
may nangyari sa
you passed
nanay.
on, diba, parang you still want a family with your partner.
Good one.
So, we're just talking about the eggs ba muna dito or embryos? Kasi different scenario yan eh.
Eggs that become embryos.
So
Ayan,
kung umpisa muna sa eggs, kasi, di ba, solely kasi sa'yo yun, sa babae yun.
Okay.
So, your consent, sa'yo talaga yun. And in our consent, sasabihin mo yun, may mga ititik kang boxes sa amin. In case of my untimely demise or kasi ayaw man natin pag-usapan, kailangan eh.
Yeah.
I'm leaving someone to be the parang designating this person, sometimes the mommy, to decide for me, or pwede na niyang sabihin outright, itapon nyo na pagka in my untimely demise. Pwede yun. That's for eggs. And then for embryos naman kasi, it's more complicated. Kasi property niyong parehas yun eh. It's the husband and the wife. Sa inyo
kasi
parehas
ano
yun.
na, tama.
Kaya part din ng consent yan. What if one of the partners, parang something happens to one of the partners? So nasa consent din yon na I refuse, I want it to be parang to be frozen, cryopreserved. Parang ayokong ipatransfer. Nakalagay na yun sa consent. Or sasabihin niya, the surviving partner will decide. So parang lahat yan, notarized talaga. Para at least before pa, napag-usapan na natin kung anong gagawin natin sa kanila.
Walang butas, kumbaga.
Yes,
All
kasi
bases
mahirap. It can
covered.
be very, messy pag hindi natin yun inayos.
Oo, yun nga. Pero yun nga, what happens, may option na pwedeng pang magamit yun if in case okay kay wife
Kung
at
sinulat
husband.
nga at nag-sign sila parehas that the surviving partner will decide. Although, in the Philippines nga, hindi natin ginagawa yung
Correct,
surrogacy.
kasi
So,
bawal
hindi
na
rin...
surrogacy. Pero pag kunwari, abroad nila ginawa, pwede pala. I mean,
Hirap nga, hirap
scientifically,
sagutin. Scientifically, pwede.
it's possible.
Oo.
Doc, question lang
Yes.
just in case, magsara yung center niyo.
Okay.
Doc. Ilang years na ba yung...
Yung first center namin, we're celebrating our 13th year, the one in
Wow!
Makati. And then yung Quezon City Center kasi namin, mas bata. We just recently opened ng 2023 November. So, kung magsara.
Oo, anong
so,
chances na magsara?
Medyo naman.
nangyayari sa eggs?
Actually, that's a good question kasi natanong na din kami ng mga patients natin
Kailangan,
yan. Oo,
diba?
kailangan. Kaya may sagot din kami. So, kung magsasara, for example, siguro naman hindi both, 'di ba? So, meron din doon na kung something will happen, ita-transfer namin yung eggs to another center to take care of it. Parang ganon. And then, actually, part nga din ng concept na hindi ka na muna namin mai-inform if emergency. But i-inform ka namin pag natapos. Parang ganon.
Tapos, Doc, properly labeled naman yan.
Yes, everything is properly
Kasi
labeled.
Yung egg, akala mo egg mo yung pala egg
Oo
ng...
nga, actually kapraningan,
Isang-
di ba? Kapraningan questions. Pero ito,
Yes,
valid
that's a
yun.
valid
Question lang,
question.
oo.
It's a valid
yung
question.
security ng mga egg.
Di ba? Pag nagkasunog,
So,
whatever.
actually, if
Ano
you
yun?
visit our center, makikita nyo how we value yung security of knowing that it's really yours.
Yeah.
So, meron kaming finger scanning na i-register namin yung fingerprint mo. So, parang ganon. Yun yung unang-unang step namin. So, when we do the surgery, pagpasok mo sa OR, fingerprint mo yon to make sure na lahat ng labels sa operating room, yung ultrasound namin, labels na mapiprint, ikaw lang.
Okay.
So, parang one ano yun. Kasi galing yun sa fingerprint mo
Correct.
eh.
Oo.
And then, other than that, we do double checking. I-announce ng nurse yung number mo, yung name mo, para lumapit ka sa kanya. And then, pagpasok nyo sa OR, di ba, ano na yun, nag-fingerprint ka na, lalabas na lahat yung names mo dun sa records namin sa operating room. Pati sa embryology, i-announce ulit yung name mo para ma-double check namin lahat na
Ikaw yun.
Siyempre, gising ka pa. Alam mo na ikaw yun. Kasi kung ibang name yung ina-announce, for sure, malalaman mo, oy, hindi ako yan. Makakatch na kagad yan. So, that's one of, we have a lot of protocols in place to avoid yung mislabeling.
Yes.
And then, our embryologists, they work in pairs. Yan yung talagang rule namin. So, someone has to double check. Hindi pwedeng mag-isang nagtatrabaho yung embryologist.
Tama. How long is the process pala for egg freezing?
Yun. That's only 2 weeks, di ba? Like I said, day 2, we'll see you in the clinic, and then 8 to 11 days of injection. By day 12 to 14, we are already getting the eggs. Very fast. And then in that 2 weeks time, siguro makikita ka namin in the clinic around 3 to 4 times, including the egg harvest.
Ay, wow.
Mabilis lang.
So efficient. Talaga alam nila na busy lahat, no?
Oo.
3 to 4 times lang kita magkita. Huwag kang mag-alala. Ang injection mo, 11 days, pero 3 to 4 times na tayo sa clinic. Kasi di ba tayo, 11 days, babalik-balik ako.
No.
Busy ako.
Tuturuan ka namin how to do it.
Correct.
Tuturuan ka ng nurses namin. We have videos, how to show you. But of course, kung hindi nyo talaga kaya, we can do the injections. But I tell the patient, kaya mo to.
Kaya.
Kasi
Oo.
para hindi ka na pumunta every day.
So, 13
most of
years
the
na, no,
patient-
yung first.
Yes.
So, that was in
2012, yes.
2012. So, yung 2012, Doc, 2 years old pa lang yung bunso ko kasi nanganak ako noong 2010. So, kung nagpa-harvest pala ako noon, ng 2012, pwede pa yung eggs ko at the age of 40,
We still have patients who are doing that. Although, syempre mas maganda, mga 30s.
Wala na din pala pag-asa.
Yun yung hindi, pero pwede pa rin.
Gusto ko yung nagbabalak ka pa, mamu, Grabe yan, Nagbabalak pa,
Pero during that time, I think, pwedeng-pwede ka pa.
That
Kung
time,
freeless mo yung eggs mo during that
Kaso
time.
hindi ko naman kayo na-meet ng 2012. I really
So it
wanted
was
to have
not
at least
very
3
popular
talaga.
yet eh.
3.
Actually kasi, sa totoo lang, natanggal lang yung elective na, yung tawag doon, yung sa egg freezing, doon sa, parang hindi na siya, parang accepted na siya nung 2013 all over the world. Parang ganon.
Before that, hindi pa pala.
Hindi pa
Prior to
masyado
that.
kasi more on for ano pa siya eh. Ay, experimental.
oo.
Kasi before,
Experimental.
experimental before 2013.
I
And then,
see.
2013, yung ESHRE, tinanggal na nila yung term na experimental sa egg freezing. So, mas ginagawa na talaga
Ayun
siya.
na.
That's nice. Last na
Yes.
lang, Doc, before we let you go and promote your
Yeah.
clinic, what can you say about women now in their 40s giving birth more than teens?
You mean,
Because there's a recent studies that show
More
na mas marami na raw
40s na
women
women.
in
40s na nanganganak.
Oo.
Okay. Actually, even getting pregnant pa lang, medyo mas mahirap na kasi talaga eh. Remember what I told you about the age of 35 na biglang babagsak na yung fertility rate, tataas yung miscarriage rate. So kasi kung yun yung magiging plan natin, mas madami tayong complications na dapat maging handa. Kasi nga, ang 35, you're already considered as high risk because of just your age. So, lalo pa yung 40, diba? Although, kaya pa din, pero mas kailangan maalagaan and kasi mas madaming possible complications such as hypertension, diabetes, nandiyan na yun eh. Oo. And even, of course, the rate of having abnormal babies kasi compared to a 40 years old and a 20 years old, syempre, mas mataas yung rate for abnormal babies for
Risk,
older
no?
patients. The risk. I'm talking about the risk.
The
ah.
risk.
Oo, the risk.
But it's
yeah.
still doable. We have a lot of patients.
Oo. And that's happening right now. What I was saying is, yung studies na kaka-publish lang, mas marami ng women in their 40s who are having kids versus teens for the first time.
Ayun yung may
It's probably
nagpa-freeze na
because,
Oo nga.
di ba,
Shift
nagkaroon
nga.
na ng shift because of women empowerment.
Yes.
Women wanted to work first,
Yes.
to improve in their career.
Yeah.
It's really because of that.
Yeah.
Hindi na yung tayo nasa bahay tayo
Yeah.
na magkaanak na kagad. I think it's because of that. And
Uh-huh.
parang mas open na for...
Kaya nakakatuwa nga si Carla, naging very open siya.
Yes.
Kasi I learned so much from her posts na possible pala to. Good na lang na she was very open and sharing her experience on social media. Galing nga.
Yeah.
Kaya good luck. I pray for Carla na pag ready na siya. Excited ako na yung kanyang maging baby. Yun na yung pinrease,
Yes.
tapos maging embryo, tapos
That's right.
magbuntis na siya. May PCOS ba siya? Tama ba, Doc?
No, I cannot talk about it.
Pero
I'm
yung
so
mga may
sorry.
PCOS, pero yung mga may PCOS, may mga harvest ba yun na
Na eggs.
Na eggs. Kasi may PCOS
meron pa din naman. So, talking about patients with polycystic ovary syndrome talaga. 'Di ba? Kaya sila polycystic ovary syndrome kasi yung ovaries nila, madaming mga maliliit na cysts. Kaya siya polycystic. Parang ganon.
Madami.
Tapos, pero may criteria yun hindi lang yun yung sole na criteria for the diagnosis of polycystic ovary syndrome. So, meron pa din paring ma-harvest. Although, minsan sinasabi ko sa patient, sometimes yung quality ng eggs nila hindi kasing ganda ng someone without PCOS.
Okay.
Although madami pa rin nakukuha.
Oh, that's
Madami
nice.
pa.
Alright. Doc, thank you so much. Please promote your clinic.
Doc.
Saan po ba pwedeng puntahan, bisitahin?
Okay, so if you're considering egg freezing or if you're just even thinking about it, visit us. Talk to us so we can answer your questions. We can guide you through the process. We can address your hesitations. Visit us in Cato QC, that's in Conceive IVF Manila along Quezon Avenue, sa harap lang ng National Bookstore. So it's very easy to go to.
Yeah.
And then our other clinic is in Makati. It's at the Enterprise Center.
Ayun,
So Cato Repro Biotech Center.
Ayun. Papahabol lang So, syempre nag-google ako. Carla Abellanas not publicly confirmed that she has PCOS. But what she has mentioned, siya yung nag-mention, she had hypothyroidism, which she revealed and diagnosed in 2019 and was perimenopausal pala at age 37. Wow, ang aga nun para maging perimenopausal siya. Yun ang sinabi niya as revealed by GMA Network. So I never knew na nag-perimenopause siya at 37.
I'm not sure about the news. So
it's here
I cannot comment about it, and also I cannot reveal any medical conditions.
Ayun lang, I'm just reading from the GMA Network site.
So I have no comment.
She was diagnosed. Sinishare ko
I
lang
hope
din
you
sa
understand.
viewers natin. No need to comment, Doc. I was just sharing sa mga viewers natin na ni-reveal niya pala na meron siyang perimenopausal at age of 37 and hypothyroidism.
Pero buti na lang naka-harvest, di ba?
Yun yung maganda.
Bongga-bongga. Exciting.
Yes, may option talaga.
Correct, yun
Thank
nga.
you, Doc Edna Lynn.
Thank you, Doc Edna Lynn of Medical Director po of Conceive IVP.
IVF.
IVF pala.
Manila.
Sorry again, it's Conceive
IVF Manila.
Thank you, Doc.
Thank you, Doc.
Thank you so much for having us.
Ang daming
Welcome, Doc.
naliwanagan, lalo na yung mga
Oo.
viewers natin na bata-bata pa, di ba?